Welcome to I Wonder Wednesdays, or is it
Yeah, I
Wonder?
Wednesdays. What do you guys think? Do you like it I
Wonder?
Wednesdays or I Wonder Wednesdays? Let us know.
Leave a comment. We've heard it's dorky one way or the other.
Yeah.
So today we're going to be discussing macular degeneration. It's a disease that many older patients end up with, and there are quite a few questions concerning macular degeneration.
Right. The one question that came up that relates to macular degeneration was a comment that was made by Sherry Hausman. She asked, what foods are good for my eyes? And that's a great question in relation to macular degeneration, because for dry macular degeneration, basically nutrition is the main thing that we have to treat dry macular degeneration or prevent it from getting worse, actually. And so foods and vitamins, that's huge on that.
So the question is, which foods?
Right.
I tell patients that foods that are deeply colored, so broccoli, kale, strawberries, blueberries, blackberries, anything, and then apples that have that, but you have to eat the skins, you can't peel them, or carrots really are good for your eyes. That's not a myth. Those foods carry something called beta carotene in them, and that beta carotene, which is a form of vitamin A, it helps the macula perform better and be healthier and hopefully help prevent that macular degeneration.
What are the best vitamins for macular degeneration? Basically, you want to get lutein and zeaxanthin. Those were the main vitamins in two big studies, actually, that they did, the age-related eye disease study. They did it 2 times. So you'll see on the shelves at the grocery store at Walmart, you'll see macular degeneration vitamins, A-REDS 2. And that refers to the big age-related eye disease study there. And so there are vitamins, we have them at our office, that have that exact formula, the A-REDS 2, which has been shown in the big studies to prevent dry macular degeneration from getting worse.
So do you take vitamins or do you eat better food? That's up to you. Some people like to take pills, take the vitamins. If you prefer to eat whole foods, your body processes those better. So kind of up to you. Dr. Hausman mentioned dry macular degeneration. There are 2 forms of macular degeneration, 2 major forms. Dry macular degeneration is where the macula, which is the center of your vision, it's kind of like the sweet spot. Whenever you look at something, your eye is automatically putting that macula on what you're looking at. So what ends up happening is as people age, they end up having a decrease in the function of that macula. And when it's dry, when Dr. Hausman and I look inside the eye, what we see is a lack of pigment. So that macula is supposed to be nice and dark. That's why foods that are darkly colored give us more of that pigment inside the eye. So when the eye loses its darkness at the macula, it causes that macula not to focus. So people with macular degeneration of either form do not go completely blind, but they can become legally blind. That can be confusing. Legal blindness means that they can't see in the center and they can't see a certain size of letter, but they still have their peripheral vision. Dry macular degeneration has been thought of as only being treated by vitamins or foods at this point. The FDA has recently released a couple of drugs for dry macular degeneration of a certain type called geographic atrophy. They're still in their infancy stages, and the first drug that came out, our retinal specialists have decided not to use. It hasn't been a good fit. So we're kind of watching that. We stay up to date on that. And then I'll let Dr. Hausman talk about wet macular degeneration.
Well, with wet macular degeneration, that's the one where you have to have injections into your eye to help and decrease the swelling that happens with the wet macular degeneration. With wet macular degeneration, there's bleeding at the macula, bleeding and swelling. And they found it's very effective. It sounds horrible, but every single patient that has injections into their eye, they're like, you know what? It's not that bad. It sounds horrible.
They numb you first, by the way. They don't just hold you down and do it. They numb you.
Exactly.
So, and the eye can be completely numbed by a topical eye drop, which is great.
Yeah.
But it has saved some vision in quite a few patients.
Yes, it does make a difference. So there are treatments available.
Yeah.
Yeah.
There are.
Yeah.
So don't feel like if somebody's given you or your family member the diagnosis of macular degeneration that automatically leads to blindness.
Right.
Be sure you see your doctor once a year. That's the best way to make sure that we're keeping track of that. And if any treatments come available, we know that, and then we send you to the specific specialist that you would need for that macular degeneration.
Right. If you have comments, questions, please leave those comments and questions below. We'd love to hear from you, and that can help us decide what topics to present in future episodes right there.
Yeah. And don't forget to like us on Facebook, Instagram, YouTube.
Yeah. Thank you so much for watching. Really appreciate it.
Have a great day.
Bye.